Erectile dysfunction is defined as the inability to have penetrative intercourse and affects about half of men over the age of 52. But the questions that most of my patients ask is, why do people even get erectile dysfunction? Well, the number one cause is due to vascular problems, and that includes issues like high blood pressure, high cholesterol, lack of exercise, and smoking. Another 30% comes from diabetes. Over half of men with diabetes will develop erectile dysfunction. In fact, having the disorder itself increases your risk by 3.5 times. And the longer you have diabetes, the more likely you are to develop erectile dysfunction. That's because diabetes affects the blood flow and the nerves to the penis, both of which are extremely important for erections. Medications contribute to another 15%, and that includes most commonly medications for blood pressure, specifically those that are called thiazides or beta blockers like metoprolol, which is very commonly prescribed. Also, medications for depression, specifically SSRIs or serotonin selective reuptake inhibitors, commonly cause issues with erections. Other smaller causes of erectile dysfunction include neurologic causes, specifically things that affect the nerve function to the penis. That can include spinal cord injury, multiple sclerosis, or other neurologic conditions. Another 5% comes from pelvic surgeries like prostatectomy or other surgeries that happen in the lower part of the abdomen where the nerves course that go to the penis. And lastly, a very small percent, about 3%, are due to hormonal causes like low testosterone, low thyroid, or issues with your pituitary gland. Erectile dysfunction, you should go see your primary care doctor and urologist. Particularly, you should be screened by your primary care doctor for cardiac disease risk factors, because erectile dysfunction can be the first sign of heart disease. And so if you want to learn more about that, check out my video that I made before about how erections can be the first sign of heart disease. When you see your doctor to talk about your issues with erections, they'll get a history from you. They'll ask a lot of questions about your experience with erections in the past, if this has been gradual or sudden, if you've had any trauma recently, as well as a physical examination to rule out any other physical causes that might be contributing. And often with that, we'll also get an early morning testosterone blood draw to make sure that you don't have any hormonal causes like low testosterone. Based on the history and physical examination, we can rule out things like psychogenic causes or factors that may be associated with your thoughts around performance anxiety that might be contributing to erectile dysfunction that are best treated by a sexual therapist or psychologist. Some people might offer is a penile Doppler test, and this test looks at the blood flow to the penis. However, very often it doesn't change management. What it does do is it allows us to provide reassurance for patients who might have psychological causes of erectile dysfunction. And most commonly, it's used for young men who've had some sort of trauma and had a sudden onset of erectile dysfunction to identify areas that may have developed an abnormality called an arteriovenous fistula. And the reason there's not a whole lot of other diagnostic testing is because the treatment essentially is almost always the same. Unless you've had a trauma and you might benefit from a very selective surgery, which is extremely rare, then the treatment, as I mentioned, is always the same. So we start with lifestyle changes. So what can you do sitting at home to help improve your erections? So if you think about things that can help your erections, well, anything that's good for your heart is also going to be good for your erections. The most studied type of dietary changes are the Mediterranean diet, which is diet high in fresh produce, fish, and polyunsaturated oils like olive oil. You want to avoid processed foods, anything that comes in a box really, saturated fats, dairy, and red meat. And in studies, they've shown that having a Mediterranean diet has improved erectile dysfunction or slowed the rate of decline in strength of erections. Exercise is also a great way to help improve erections. Multiple studies have proven this, and you want to ideally aim for 60 minutes 3 times a week. Now, you can break that up as much as you want. You can do 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes later, and you can do it over the course of the 7 days. So it doesn't have to be a big ordeal. It doesn't have to be all at once. Lastly, if you are on some of the medications that might cause erectile dysfunction, and we'll put up a list right here, you can talk to your doctor about trying to switch to either another hypertensive medication for high blood pressure or another medication for depression that might have less side effects for erections. And lastly, very simply, quit smoking if you are, because that's not going to help your erections. And if you're having alcohol on a chronic basis, meaning daily with large amounts, try to limit that or decrease that significantly, because that will also help with your erections. A lot of you ask if there's any supplements or herbal medications that can help. Well, there's some major issues here. Is one, we don't know exactly what is in the supplements. They're unregulated, and the ingredients and dosages listed on the bottle may not be what's actually in the supplement. And sometimes they're even contaminated with other medications that we already use for erectile dysfunction, like tadalafil or sildenafil or heavy metals. Interestingly, the placebo effect, which is when you take a pill that you think is going to improve your erections, is quite high in studies for erectile dysfunction. That's why we do randomized controlled trials, because when you take something and you think it's going to improve your erections, it actually does by up to 30%. And so when you see people saying they've had these great results with certain supplements, well, a lot of it can be from that placebo effect. Let's move on to medical treatment. So I talked a lot about